Good morning, good afternoon, good evening, colleagues, from wherever you are joining this very interesting and important webinar on looking at the aspects of access to genetic resources and benefit sharing in the context of One Health. I'm grateful for the invitation. As you can see, my name is Balakrishna Pisupati. I work at the UN Environment Program. And what I'm going to be doing in the next few minutes is to give you a little bit of a context within which we are discussing access and benefit sharing in 2024. And as you can see from the title, the issue of access and benefit sharing, even during the negotiations of the convention itself and the Nairobi Final Act, and as and when the text for the convention, Article 15, was being negotiated and put in place, the fundamental principle on which access and benefit sharing discussions were held was to look at balancing the rights of providers and users. So that is, to an extent, the fundamental principle based on which we all started looking at the issue of access and benefit sharing. And if we are going to be looking at the evolution of the discussions on access and benefit sharing in the context of Nagoya Protocol, the principles of equity and fairness are universally accepted. There is no one who denies the fact that when somebody benefits from using a resource, the provider of the resource should be compensated, should be provided with some benefit of such profit that is being made by the user. So even though in principle this particular issue has been agreed, it took several years, more than a decade and a half, to operationalize the entire principles of fairness and equity in the context of access to resources and sharing the benefits when the resources were commercially exploited and used. But the challenge has always been in the operationalization of this entire thing. And what the Nagoya Protocol provides us is a framework within which a lot of these things are happening. Having been associated with the discussions on access and benefit sharing almost since 1994, when I first organized a regional consultation for Asia, when I was working at IUCN at that time, the fundamental question I asked to myself is that why is this entire issue of access and benefit sharing so complicated and complex? And that actually also has a resonance in the way some of the things are being discussed in the context of One Health approaches today. Because fundamentally, when you're talking of One Health, we are looking at the issue of access to resources for human health, access to resources for animal health, access to resources for environmental health, and all of them related. But in the context of the Convention on Biological Diversity, a number of these issues are discussed fairly, to an extent, independent, because other processes started emerging much later than the discussions under the Convention on Biological Diversity had started. So the access and benefit sharing issues, if one is going to be looking at it on where the complexities lies, the complexities lies at four levels. One, at the level of ABS issues for providers of genetic resource. Two is ABS issues for the users of genetic resource. And three, ABS issues for policymakers and ABS issues for implementers. And what I'm going to do is to very quickly take you to four cartoons. I just want to make it a little easy and simple for us to understand where the challenges or where the issues for all these four groups of stakeholders have been in the context of access and benefit sharing. If you look at the cartoon there or the picture there, that actually to an extent explains the challenges, the access and benefit sharing issues are faced by the providers. As you can see from that cartoon, this person is trying to look at the end of the roll of tape. Of course, he knows that the tape is too big, it's quite voluminous, you can use it for too long. But where to start? Where do we start the discussions in terms of providing access, and what kind of benefits should the providers be asking for has always been an issue of challenge. And to a large extent, even though countries have progressed in the issue of access and benefit sharing, if there is one question where we still have not found correct and clear answers, is that are we looking at benefits? Are we looking at the resources that are being accessed and the benefit sharing associated with it, including on traditional knowledge? Are we adequately addressing the issue of value of these resources? To an extent, unless the values are very clear, the discussions on benefits are going to be unclear to the extent that we can imagine. The second issue, or the second group of people who really sometimes get caught up or get caught with these discussions, not necessarily being very clear of where they started and where they're going to end up, will be the users. So that's where the perspective for ABS, or the access and benefit sharing for users, is something like what you see on the cartoon, where this lady is saying that he is not walking backwards, but you've got the leash on the wrong end. So certainly for a lot of users, this is exactly the kind of situation they find themselves in, with lack of clarity on what needs to be done, where they have to start, and which direction they should be moving. In spite of countries having the ABS frameworks, still there are actually lack of clarity and gaps in the way users are able to understand and then put their act together in terms of responding to the access and benefit sharing provisions. A key element of it is this very fundamental principle of access and benefit sharing discussions, because remember, access and benefit sharing has to be negotiated. It has to be negotiated between the provider and the user. But to an extent, many states actually still have not clearly understood the negotiation element of access and benefit sharing. We have this interesting group of stakeholders, policymakers, who discuss and develop the frameworks on access and benefit sharing. And as you can see from that slide, it is like a maze where we still have challenges in terms of policymakers on where to start and where to end, which direction they should go, which turn they should take, so that they can enter the maze of policymaking related to access and benefit sharing. But they come out successfully with having a framework that actually captures the elements of fairness and equity and benefit sharing. And the last set of stakeholders are those who are the implementers, because not necessarily the policymakers are the implementers. Implementers are the local governments, implementers are the providers, implementers are the users, implementers are the research organizations. So certainly what you see on the screen, that particular cartoon also captures to an extent where the implementers see for themselves, where this person is saying that according to these advanced formulas, we are way underpaid. So essentially, all of us know what the problems are, but we still are looking at complex algorithms and complex ways of understanding what these problems are. And that's where some of the challenges related to access and benefit sharing implementation comes to play at the national level. So today, if you are going to be looking at access and benefit sharing in 2024, those 5 are the key elements that are the questions that we need to be asking for ourselves. Is access and benefit sharing providing the benefits that it is intended to provide? Are these efforts to find synergies among different processes and institutions working? Today, I'm sure through this particular event, we are going to listen to a number of different presentations, including from the World Health Organization, where there is a discussion that is going on access and benefit sharing in the context of an international negotiation for developing a treaty on pandemic readiness. So definitely there are questions being asked on, are these approaches, are the principles under which access and benefit sharing is being discussed, whether it is in the Convention on Biological Diversity, whether it is in the International Treaty on Plant Genetic Resources, whether it is in the WHO parlance. And also remember, we do have a new treaty, the Biodiversity Beyond National Jurisdictions, that also discusses the issue of access and benefit sharing. So it is very important to understand on how these processes actually are talking to each other and where there are similarities and differences to deal with it. And the third question is to ask ourselves, in spite of the protocol that was adopted and had come into force and countries having national frameworks on access and benefit sharing, is it very effectively being implemented? And one measure of effectiveness is the amount of resources, monetary or non-monetary benefits, that are flowing back to communities, that are flowing back to conservation efforts that we need to discuss. The fourth question is the link between access and benefit sharing and the issues of digital sequence information and benefit sharing. We are all aware of the outcomes, very good outcomes of the Cali COP16 meeting of the Convention on Biodiversity, but it is very important to reconcile the elements of the discussions on benefit sharing, the Cali Fund, the operationalization of the Cali Fund in the context of access and benefit sharing. And lastly and importantly, is the industry aware of their obligations? And I would say, having been working and been associated with a number of these discussions for many, many years, still the industry is unclear on their roles and responsibilities. The environmental perspective of access and benefit sharing in this context is to look at those 4 elements of it. the conservation and sustainable use perspective coming from the Convention on Biodiversity, the human health perspective coming from the World Health Organization, the plant health perspective coming from the International Plant Protection Convention, and lastly, importantly, the animal health perspective coming from FAO and its processes and activities. So under the One Health approaches, if one is going to be looking at where we start and where the discussions need to be pegged, those are the four elements that I will would like to share and end my presentation. One is ABS approaches deal with plant, animal, microbial, and digital resources, but each one of them they are unique, they are different, and they actually need a different form of discussion when it comes to benefit sharing. The current processes on access and benefit sharing and the discussions on digital sequence information to an extent need to be consolidated, and we need to find linkages. Past efforts to understand and integrate such approaches not necessarily have yielded at the best possible results. And lastly, national capacities and understanding is still limited on ABS issues related to One Health approaches. So what we require today is not to look at ABS in a very siloed approach, but look at ABS as an integrated option, as an integrated approach for looking at conservation, sustainable use, and fairness and equity in the context of raising financial resources, but also plowing it back for community development and sustainable development. Thank you very much for your interest, and thank you very much for your cooperation and for listening to the presentation. And apologies for not being able to be present at the webinar, joining live in person. Thank you very much. Bye.